Our Region's Business is sponsored by PNC for the Achiever in You. Welcome to Our Region's Business with your host, Bill Flanagan.
Today on Our Region's Business, our region's role in creating the world's largest vocabulary lesson and what it means to the ROI in early childhood education. But first, Highmark's kinder, gentler approach to healthcare. After 3 years of turmoil involving Highmark and UPMC, and in the wake of the introduction of Obamacare, a new CEO is at the helm of Highmark, a $16 billion company based right here in our region. David Holmberg's no stranger to Highmark. He's been with the company for 7 years, running diversified businesses that generated $3.5 billion in revenue by themselves, and now he's at the home office in Pittsburgh, and David Holmberg joins us now. Welcome. Good to see you.
Thank you very much. It's nice to be home.
Yeah, and you've been with the company for a while, so you're no stranger to Highmark.
Yeah, I've been with the company for 7 years. You know, I've been responsible for all the national businesses, so I've been running those out of San Antonio for the last few years, but I grew up in Ohio, lived in Erie for a couple of years, so for my family and I, this is like coming home.
That's great. I'm sure a lot of folks who live here in our region aren't even aware that Highmark has these big national businesses, Vision Care and others. What was in that portfolio?
Well, I mean, to your point, I mean, we have the Vision Care company, which is VisionWorks, which is the retail company, and that's a national brand that we've developed over the last 7 years. In addition, we have United Concordia Dental, which our biggest customer is the active duty military for the United States of America. So we take care of anything that they can't take care of on base. And so we play a very important role with the Department of Defense, and that's all done here out of Pennsylvania.
Wow, okay, and so that's that portfolio. And your background even before that was not in healthcare. You were with Joann Stores, the fabric company, for a while, and other retailers?
That's right. I mean, my career started in the jewelry business and in retail.
Okay.
And I was always in high touch, high service businesses. And about 14 years ago, I got involved in the optical business, which I found very interesting because it had a medical component, it had a manufacturing component, and it was a very complex business to operate because every single thing that we made was customized for that individual. And so it's very similar to healthcare in that standpoint. Healthcare is a very personal experience. And what I found was that my consumer focus, the leadership skills that I learned over the years are very applicable to all the change that's going on in healthcare today. And so it makes it an exciting time for me to lead a Highmark Health in an organization that's trying to lead that change.
Yeah, it seems like a giant leap, but I guess there's a more logical transition here than it might appear on the surface. So obviously, for 7 years, you're in Texas. You're sort of out of the mix of the controversy and all the furor we've had here in Pittsburgh. What was your perception of it there, and what did you find when you got here to Pittsburgh?
Well, I mean, first of all, everybody forgot to tell me that healthcare in Pennsylvania is a contact sport. So I've had to adjust a little bit to that, but I certainly welcome the challenges. My perception was that there were real important issues that were starting to emerge here in western Pennsylvania that are really being driven by national trends. The addition of all the people in healthcare through the Affordable Care Act that are being covered, the trend from moving from traditional in-hospital, in-bed care to more outpatient care and more prescription use to help manage various conditions. All those trends are driving real change in the marketplace, and that's in the backdrop of the challenge that we all have, which is that 17% of the economy of the United States is now devoted to health care, and that's up dramatically over the last 10 years. And so between those things, it's really playing out at a much faster pace here in western Pennsylvania for local reasons. And for me, I was involved in the strategy, enabled me to be a part of the conversations, but I didn't have the emotion that was maybe a little close to home up here. And so as I've looked at the situation, I've tried to identify the national trends that we need to address, and also recognized the importance of focusing on the customers and the members and the patients and the community and really giving them choice. And so what I see as an opportunity to really drive more choice for consumers, give them the option to be able to choose the place they receive care, the kind of care they receive and the affordability of that. And that's what we're trying to build with the Highmark Health system.
Yeah, it's a big change for a company that was primarily in the insurance business to before, now delivering care as well. How's that culture working out? How's that integration coming along?
You know what, it's been far better than expected, and since I got involved in May, on a day in and day out basis, I couldn't have asked for more engagement and excitement among our folks. We are 100% committed to the Allegheny Health Network and helping the independent hospitals, the independent doctors, et cetera, be successful. We think that's very important to fulfill our core mission, which is to improve the overall health of the community, to provide access to care, and to make sure that it's affordable. And so a lot of what we're doing, we think Highmark Health is very uniquely positioned because we're the bridge between the insurers and how healthcare is paid for, and now we have the ability to affect the outcomes and the type of care and the service level that people receive. So we think that's really, really important, and it's a responsibility that we think is unique to Highmark Health because employers in the region, I was with a group of 40 small business owners who had 50 to 100 employees. And they all said the same thing to me is the cost of health care is making it difficult to justify hiring that next person in their shops. And so they're looking to us to come up with innovative ways to improve outcomes and create care, but also to make it affordable. And we think Highmark Health, with the insurance company, with our diversified businesses, which bring resources back to Pennsylvania and to West Virginia to help provide for care, and now the Allegheny Health Network, enables us to make changes that will create real value and take costs out of the system.
When we come back in our next segment, I want to ask you a little bit about some of those changes on the ground. But before that, I got to ask you about one of the big controversies you found yourself in the middle of just in the last few weeks, and that was the state regulators initially complaining about this HMO Medicare plan that you all had launched. But I understand Commonwealth Court is now found in your favor. What's that all about?
Well, I mean, it's really about the right for seniors to have choice. So, Highmark added an additional option to its Medicare Advantage program, and that option enabled people who are on a fixed budget or are concerned about their out-of-pocket health care costs to be able to have a no-premium, Community Blue Medicare Advantage product, so that they didn't have to have that uncertainty that can come with health care. And so what the judge ruled this past week was that Highmark absolutely had the right to do that, and that the federal government had encouraged us to do that because what it's giving is choice, and we truly believe that that's important. And what it's also doing is addressing real cost issues. There are many products out there for seniors who want to have every provider in the marketplace available to them, and we offer those products in our own portfolio.
So you're not, because I remember when the big TV wars were going on a few months ago, a lot was said, hey, none of this will affect Medicare customers of Highmark. You'll have access to all systems. So this is an additional product for people that want a really low-cost plan that does restrict access, right, to your hospitals.
So that's correct. I mean, it's all of the existing Medicare products that we had out there continue to go forward exactly as is. This is an additional option, and again, I believe that it's our responsibility is to give seniors the choice as to what's best for them. It's not my decision or your decision, it's their decision as to what they should have. And what we wanted to offer was a proven product in the marketplace that enabled seniors to have no premium and minimal co-pays, and as part of that, they had a more exclusive offering of providers through the Allegheny Health Network, through participating community hospitals and regional hospitals, as well as many of the independent doctors. And what the judge ruled was that was very important to go forward, and that we had the right and seniors had the right to have that product available to them so they could make their own choice.
All right, well, when we come back, I want to talk about other kinds of products that are going to be available as this whole healthcare landscape continues to evolve in our region. So we'll be back with more of our region's business right after this. Stay with us.